Howdy, everyone. Matt here. I got a question for you. Do you think there is a bean soup theory for exercises? Let's talk about it. All right, everyone. First and foremost, let me introduce myself. My name is Matt. I am Matt the PT, coming at you with another video, another topic of something from the physical therapy world. And this one is a bean soup theory. And you're probably going, Matt, what in the world is bean soup theory? Well, I will tell you, and you can, of course, look this up as well. But several months, years ago, a period in the past, an individual, a creator, put out a recipe for a bean soup. And the purpose of this bean soup was for individuals who are anemic, saying, okay, you use these 15 different types of beans in this soup and you consume it and it helps you. And that's what I believe. I think I even maybe saw the video at one point or another. But that's the basis. Well, individuals in the comments started saying, well, what if I don't like beans? Okay, that's where the problem was. This soup is specifically, like, the only thing in it is beans. And these people are saying, well, what if I don't like it? I want to make it, but what if I don't like beans? Okay. And it brought about this theory, and people have applied it to different things, and saying that it is when an individual makes that whatever that someone has posted about them. And somehow, okay, you did that. Well, now I got to try to twist and bend it to make it about me. Okay. And I've seen this quite often more in the cooking world, that somebody will put out a recipe. You know, they pop up on your pages every once in a while. They look pretty good. And somebody will say, like, oh, well, here is a strawberry cake recipe. And then somebody will respond back and say, well, what if I don't like strawberries? Well, the point is, you don't make it. The strawberries are a key ingredient of it. Don't make it. If you don't like it, don't make it. Okay. And so that is just applied for all this stuff, all these different things. Well, I'll say, I've been seeing this with exercise. Okay. And more along in like the rehab and the exercise, that people are coming out and doing this. And some individuals have spoken against it, but I just kind of want to talk about this a little bit more. And kind of the thing that I'm having the issue with is that people will put out videos like, rehab exercises. And we've all seen it. There are those pages where somebody's like, hey, here are 5 exercises to stretch your shoulder. Here are 5 exercises for the knee. Here are 3 things you can do for low back pain. And they could be very general, or they could be very complex and whatnot. But then what I have been seeing is that somebody will then make a video kind of dismissing those exercises, to say like, no, that's wrong to do. That's not what you do. You need to do this. And it really came about from, I saw this video, and it was a chiropractor, and he's like a brain-based chiropractor, which I don't even really understand what that is. And some of the stuff he said is just really out there. But was tagging someone's video that they were using a retraction extension, and saying like, you started doing this and all your neck tightness went away. So that person is showing, okay, you do this movement and it helps this. To which the other person, that brain-based chiropractor, was like, that's good, but you need to put in some of this to get it even better. It's like, what are you talking about? Okay, you've added something into that did not even need to be there. Okay, and that's something else I've seen at times, that what it is that people create these things and they want to dismiss those other exercises, to say those other things aren't good enough. They aren't right. You need to do these other things. I've seen that with other stuff, with like treating the neck. I saw somebody sent me something. That it was somebody I've been worked with for a while. just kind of on and off. And they sent me this thing of a person that was like, oh, you just get these chin tucks for, neck pain. That doesn't do anything. You need to be doing it. And they were confused going, why did you give me these? Okay. But this person is saying this. And I had to stop to say, hang on. Okay. One, that other page did just turn off their comments. And I think that's kind of suspicious. They turn off their comments on it. But I said, look, I gave you the retractions for a very specific reason. You were having a central neck pain. They were to reduce and abolish those neck symptoms. What this person is saying that you should be doing, isn't lining up with what you had going on. I would have given you those if that is what you had needed. And it was kind of a confusing thing to them. They're going like, hang on. You're making it sound like I need to do these like super like low dose. This isn't the right thing. Why are you not telling this? But it was this person just really just wanting to be a little extra. Oh, okay, we got to do more with this stuff. And it was sending a very confusing message to a patient. If you ever dealt with a bean soup theory in rehab, hit that like button. And of course, subscribe to the channel. Back to the video. I recently saw someone else talking about that an individual was just showing some very basic shoulder exercises for rehab. Standing external rotation, standing internal rotation, very simple, basic exercises. And they were saying, look, we need to really talk about this, that we don't need to sit there and demonize or to say those simple little exercises are bad, are not enough, are not good, because they have their place. And we have to understand all exercises, movements, modalities, all that have a specific place. Okay. They have a place. The chin tucks, they have a specific place. Are there progressions for them? Yes, there are a whole lot of progressions. Are there neck strengthening stuff? Yes. Are there shoulder exercises that are very basic, a standing external and internal rotation? Yes, they have their places. We don't have to sit there and say, well, let's do these way more dynamic. You need to be doing way more dynamic things with your patients to do all of these other things, because it can send a poor message out there. Now, granted, I don't believe all patients are online looking at all of this stuff and seeing it, but a good number do start looking on, start Googling stuff, start looking at social media, and it can send something confusing to them, because all of a sudden it's like, well, this big page or this person, maybe they just bought a bunch of followers. I've been seeing people do that stuff. They just buy all these followers. But this person is saying, well, these are bad, but why did you give me these things that are bad? You should be doing this. It's like, look, you need to be, here. You can only tolerate right here. You can only do what is right here. We can't do that because you can't even do the basics. But I think it's really important that if people are going to put that stuff out there, you need to explain the why behind it. Don't demonize. Don't say something is bad or not enough, or that the therapist who has given that to you is a poor therapist or a below average therapist because they're giving you these extra. They have a place. There could be a reason for it. Again, it could be all that the person tolerates. It may be for a specific, like they said, the chin tuck. There's a reason why we give you that. There is a reason why. And that gets lost. And I think we need to talk about that more and put that out there. Goes, hey, if you're going to be with these all crazy stuff, say the why. Say exactly the why and where you have to go to get there. Anyway, this is a little short and sweet one on here. Let me know your thoughts and your opinions and your belief about that all down in the comments. Let me know, what do you think about that? Does it drive you nuts when you see that stuff? Do you think it's just crazy that people show that? Is it just like, okay, just stop. You're just being extra for the point of being extra. That is it. Let me know down in the comments. If you like the video, hit the thumbs up button and subscribe to the channel. It doesn't cost you a copay. And until next time, take care of yourself. Take care of your patients. I'll see you then.